when I'm talking to a patient regarding the possibility of performing an outpatient knee replacement, I think it's important to share with them some of the advantages of that procedure. I think the biggest advantage is probably cost. I think to perform as an outpatient with less resources, less length of stay, is a cost savings to the health and care environment. Number two is there's something wonderful about being out of the hospital. Hospital traditionally is a place for sick patients, and there's many patients there with active disease. And we like to take these patients who we believe are healthy. This is a healthy procedure and can, in today's world, be performed as an outpatient. Those patients now accelerate through the recovery, get home, sleep in their own bed that night, and in the long run, take advantage of that outpatient procedure.